Okay, get ready, because today we're going deep on uh, this idea of depression in kids with chronic kidney disease.
Yeah, it's not something most people would even think about, but it's definitely something we need to understand better.
Absolutely. And to help us out, we've got some really interesting research straight out of Wroclaw Medical University, published in Advances in Clinical and Experimental Medicine.
Definitely some groundbreaking stuff.
And we're lucky to have you here to break it all down for us.
I'm happy to help make sense of it all.
So before we get into the nitty-gritty, let's just take a step back for our listeners and think about chronic kidney disease, or CKD for short. It's a tough diagnosis for anyone, but for a child, wow, it can be especially challenging.
For sure. I mean, imagine being a kid, right, and having to deal with all these medications and hospital visits, diet restrictions, all while you're trying to grow up and just be a kid.
It's a lot to handle, and it really highlights how important mental health support is for these kids. And that's where this study comes in. They looked at 73 children with CKD, and they found that 11% of them showed signs of depression. And even more striking, 8.2% met the full criteria for clinical depression.
Wow, that's a lot higher than you see in the general population of kids.
Yeah, usually it's around 3% or so, which really makes you wonder about the hidden struggles these kids are going through
Absolutely.
and how important early diagnosis and intervention really is.
You're right on the money there. Early diagnosis is so important. The study actually found that the younger a child is when they're diagnosed with CKD, the greater their risk of developing depression later on.
That's really tough to hear, but it also makes it clear that we need to give these kids the right support right from the
Yeah.
start.
Right from the get-go.
If we can address these emotional challenges early on, maybe, just maybe, we can help them build some resilience for the journey ahead.
I think that's the key, building that resilience.
Now, there's another piece of this puzzle we need to talk about, and that's the possibility that CKD itself could be playing a role in these mood disorders. It's not just about being stressed or overwhelmed.
Right, and that's what this study hints at.
It suggests that as CKD progresses, it might actually start to affect the brain's chemistry.
It's a bit scary when you think about it.
It is, yeah. But the good news is that if we understand those biological links, we can start developing more targeted treatments.
More precise, yeah.
Okay, so now I want to shift gears a bit and talk about another interesting finding from the study. It had to do with how parents and children rated the depression symptoms differently.
Oh, that's a good one.
Yeah, it turns out that parents consistently scored their children as more depressed than the children rated themselves.
Interesting. I wonder why that is.
Well, the researchers had a couple of ideas. First, it could be that parents are just more anxious and maybe projecting some of their own fears onto their kids.
Yeah, that makes sense.
And the other idea was that maybe kids were actually downplaying their struggles, trying to seem strong, or maybe they don't want to burden their families even more.
Yeah, I don't want to worry mom and dad, yeah.
Right. Either way, it really shows how important it is to listen to both sides of the story,
Absolutely.
to get input from both the child and their parents,
Yeah.
so we can truly understand what's going on.
Exactly, to get a complete picture.
And this also brings us back to the need for a holistic approach to care. It's not enough to just focus on the physical symptoms of CKD.
Oh, absolutely not.
We need to look at the psychological and social factors that are affecting these kids and their families.
It's all connected. You can't separate one from the other.
And that's what we're going to dig deeper into in the next part of our deep dive. So stay tuned.
I can't wait. One thing that I think really doesn't get enough attention is just how much CKD disrupts a child's life.
Right.
I mean, they're not only dealing with the physical symptoms, but also all the medical appointments, hospital stays maybe, and the constant limits on what they can eat.
Yeah, it's like this invisible burden they carry with them every day, isn't it?
Exactly. They're always having to adjust and make compromises, things that other kids their age never have to think about. And that can make them feel isolated, like they're different.
And that feeling of isolation can be really hard on kids, especially when it comes to their social lives.
Right. Think about it. Missing school, not being able to join in on activities.
Makes it hard to connect with other kids.
Exactly. And that feeling of being different can really feed into feelings of depression. It becomes like a vicious cycle. The illness isolates them, which leads to feeling down, which then makes it even harder to be social.
Ugh, it's heartbreaking.
It is.
And then on top of all that, There's the impact on school.
Oh, yeah.
CKD can affect their energy levels, their focus, even their ability to keep up with their schoolwork.
It's just another layer of difficulty on top of everything else they're dealing with. And if they don't have the right support at school, they can start falling behind, feeling inadequate, even more isolated.
It's a lot for anyone to handle, let alone a child.
So much to cope with.
And then there's this, try to imagine being a kid and having to face your own mortality. That's heavy stuff for anyone. But for a young person who's still trying to figure out who they are and what their place in the world is, I mean, that's a huge weight to carry.
It is. They may have fears, anxieties, questions about their future that they don't even know how to put into words.
And without a safe, supportive space to process those emotions, it can all build up inside, right?
Exactly, leading to more stress, more anxiety.
It's like they're carrying this invisible backpack full of worry that just gets heavier and heavier over time.
That's a great way to put it.
And of course, we can't forget the impact on the whole family. I mean, parents are going through their own anxieties and fears while trying to manage their child's medical needs, which can be really complex.
Absolutely. It's a huge emotional toll on parents.
It is.
They're often struggling with financial burdens, feeling exhausted, constantly juggling responsibilities. It's easy to feel overwhelmed and burned out.
Yeah.
And when that happens, it can make it harder for them to be there emotionally for their child.
Exactly. And then there are the siblings who often get overlooked in all of this.
Oh, yeah, the siblings.
They might feel neglected, resentful, confused. They might not really understand what their brother or sister is going through, and they can have a hard time adjusting to all the changes happening in the family.
That's a really important point you bring up. CKD affects the entire family, not just the child who's diagnosed.
Everyone needs support.
Everyone needs resources. Everyone needs a safe space to work through their emotions.
It's like creating this web of support around the whole family so they don't feel so alone in all of this.
The safety net, yeah.
And that's why this holistic approach to care is so vital. It's not just about treating the physical symptoms of CKD. It's about recognizing that mental health is just as important.
Especially for kids facing a chronic illness like this.
Exactly. It's about seeing the whole child, their emotional needs, their social life, how they're doing in school, the family dynamics. It's all connected.
Absolutely. We can't just focus on medical interventions. We need a more comprehensive approach that considers the whole child and their family.
Which means having a team of professionals working together, right?
Yes. Doctors, nurses, psychologists, social workers, educators, all communicating, all coordinating their care.
It really does take a village to support these kids and their families. And that support shouldn't stop at the hospital doors. It needs to reach into the community, schools, even the home.
It needs to be everywhere these kids are.
And everyone involved needs to be on the same page, working together to make sure these kids feel seen, heard, and supported every step of the way.
That's what it's all about.
Now, going back to that study we were talking about earlier, one thing that really stuck with me was the focus on early intervention.
Oh, yeah, that's key.
The researchers were very clear about that. The sooner we can identify and address these emotional and psychological challenges, the better the chances are for these kids.
Absolutely. Early intervention is all about preventing those feelings of sadness, isolation, anxiety, from taking hold and turning into something more serious like depression.
So we need to be having open and honest conversations with these kids and their families right from the beginning.
Right from the start, yeah.
To create a space where they feel safe, sharing their fears and anxieties, and to equip them with the tools they need to manage those challenges.
Give them coping mechanisms, help them build resilience. That's what it's all about.
And a big part of that is making sure these kids know they're not alone.
That there are people who care, that there are resources available, that there is hope.
That message of hope is so powerful.
It really is. It's what keeps us going. It's what fuels our passion for this work. And it's what gives these kids and their families the strength to keep fighting.
Wow. We've covered a lot, haven't we?
We have. It's been pretty intense.
It has, but, I think we've learned some really important things along the way.
I agree. I think it's so important to talk about the challenges these kids and their families are up against.
Absolutely.
But we also need to think about what we can do to make things better, to create a more supportive environment for them.
And that starts with awareness, right?
Yeah, the more we understand about the unique needs of children with CKD.
The better equipped we'll be to give them the right support.
Exactly. And that could mean earlier intervention, better treatments, better future overall.
And of course, we need more research. There's still so much we don't know about this link between CKD and depression in kids.
Definitely. That's where the real breakthroughs will come from.
It's not just about understanding why these children are more at risk, but also what makes some kids more resilient than others,
Right.
right? What protects them?
Right. If we can figure that out, we can start developing interventions that actually help these kids build resilience,
Yeah.
that promote well-being.
Wow, that's a game changer, going beyond just treating the symptoms and actually giving these kids the tools to live full and meaningful lives.
Exactly.
And that takes us right back to holistic care, doesn't it?
It all comes back to that, yeah.
We need to see the whole child, their emotional needs, their social life, how they're doing in school, their family.
It's all
We
connected.
can't just focus on their physical health.
Exactly. We need to break down those barriers between medical disciplines
Yeah.
and embrace this truly integrated approach.
Everyone involved in the child's care needs to work together.
Doctors, nurses, psychologists, social workers, educators.
Everyone. And they need to be communicating, sharing information.
Absolutely. It truly takes a village to support these kids and their families.
And that support can't just stay within the hospital walls. It needs to be in the community, in schools, at home.
Right, everywhere.
So that these kids feel seen, heard, and supported wherever they are.
That's the goal.
Now, going back to the study we discussed, the authors really emphasized early intervention.
Oh, yeah, that's so important.
They said the sooner we can spot and address these emotional and psychological challenges, the better off these kids will be.
Absolutely. It's about preventing those negative feelings from taking root.
From turning into something more serious.
Like depression, right? It's about being proactive.
And that means having open and honest conversations with these kids and their families right from the start.
Right, from day one.
To create a safe space for them to share their worries and fears.
And to give them tools to manage those challenges, coping skills, resilience.
And just as importantly, we need to let them know they're not alone.
That there are people who care, that there's help available, that there's hope.
That message of hope is so important.
It really is. It keeps us going. It keeps the families going.
It's what drives us to do this work.
It is. And, you know, one of the things I'm most excited about is this movement toward patient-centered care.
Oh, tell me more about that.
It's this idea that patients, even young ones, should have a say in their own healthcare decisions.
I love that. Empowering these kids to be experts in their own condition, to advocate for their needs, to make informed choices about their treatment.
Exactly. It's about shifting that balance of power, recognizing that these kids have a voice. Their perspective matters. It can help shape research, influence policies, and lead to better treatments for everyone.
We need to be listening to them, learning from them, working with them to create a future where CKD doesn't define their lives.
Well said. I think if we all work together, if we challenge the way things have always been done,
Yeah.
we can create a world where every child with CKD has the chance to thrive.
I think Professor Kilashistru-Sinska said it best.
Oh, yeah. She's amazing.
She reminded us that even the smallest acts of kindness can make a big difference.
Just a listening ear, a word of encouragement, the simple gesture of support.
Those things matter.
They do. It's about that holistic approach, remembering that these kids are so much more than their illness.
They have hopes and dreams and this incredible strength inside them.
And we can help them nurture that strength.
So let's keep this conversation going. Let's challenge the status quo and work together to build a future where every child with CKD has the chance to live a happy, healthy, fulfilling life.
I'm with you on that. That's a vision worth fighting for.
Thanks for joining us on this deep dive. We'll see you next time.